My name is Haley Boland. I am the Communications Fellow with the Office of New Student Family Programs. So today we're going to be talking about campus health services as well as CAPS. So I am here with two of our valued campus partners. Could you both introduce yourselves, please?
Sure. I'm Ken Pittman. I'm Executive Director of Campus Health.
And Alan Obar, Director of Counseling and Psychological Services.
Perfect. So I'm going to be asking you all some questions, and after that, we'll take some questions for the audience. So as you all have questions, as we move through this process, be sure to add them to the comments, and we'll get them answered at the end. All right, so let's get started. So what services do Campus Health and CAPS provide to students?
Very good. Well, I'll start. Good morning, Carolina parents. Campus Health provides primary care services through board-certified physicians, physician assistants, and nurse practitioners. We provide gynecology services, orthopedic services, sports medicine services. One of the unique models that we have at Carolina is that in the sports medicine area, our students are taken care of by the same sports medicine physicians, athletic trainers, physical therapists that our varsity athletes are. It's all the same medical model. We also provide same-day care, urgent care services. We have full-service laboratory and radiology services. We have two pharmacies on campus for our students. And all of those services are within a medical model that is accredited by the Joint Commission, which is the same accrediting body that accredits the hospitals at UNC and Duke and Wake. And so we feel like the same level of service that would be provided in terms of medical care throughout the Triangle is provided right here on campus at UNC Campus Health.
And Counseling and Psychological Services provides short-term psychotherapy and medication management, group therapy, and couples therapy to all students who have paid the student health fee. Counseling and Psychological Services works on a walk-in model, so we have front-loaded our operations to make sure that any student struggling can be seen on a same-day basis. The wait to be seen for an initial evaluation is about 30 minutes.
Perfect. So what kind of services do both entities offer to distinct student groups?
I think the thing that's interesting about Campus Health is that we are unlike a private, we're a large multi-specialty medical group, but we certainly are geared toward meeting the very specific and unique needs of our students. We have many students that choose a college if they have a chronic medical condition based on the fact that that university is located in an environment with a plethora of healthcare resources. And certainly that's what we have in the Triangle. So we treat students that come to us with diabetes. We have a multidisciplinary team of nutritionists, medical providers, psychologists that work with students that have eating disorders. We have asthma services. We have sexual assault nurse examiners on our staff that provide care and support for students that are involved in sexual assault. We provide transgender care. We provide care to students who have a diagnosis of ADHD. We provide care to students who are in health science programs and are exposed to bloodborne pathogens. So all of these are wraparound services and specialty services, if you will, that are specifically geared toward a student population.
And Counseling and Psychological Services also serves the general student population. We have 17 therapists and 5 medication providers. And all of our therapists are both generally trained and have specialty training. All of our therapists would like to be able to continue to see students as long as they can, but based on our resources, we're only able to see students for somewhere between 5 and 10 sessions. There is no real session limit, but we do limit it to brief psychotherapy, which means that if it's an issue that's happening right now with the student, we do our best to be able to help the student deal with that. And if it's an issue that's been ongoing for a long period of time and is going to require extended care with a therapist or, basically with a therapist, then we do refer that person out as soon as we figure out that that's the issue that they're dealing with. We try to make those referrals out as soon as possible once evaluating a student, so they don't get started with one therapist and then have to follow up again and start their story all over again. We do provide medication services ongoing. That is one of the services that we do bill insurance for. And so we are able to see students on an ongoing basis for medication management.
Yeah, so you touched on this. Can you talk through what the referral process is like? Say someone gets referred, how close would that be to campus for students?
Yeah, so the referring out has been an issue, I think, that has been frustrating for all members of the campus community, because in essence, each person would like to be able to have their therapist and their treatment right at the campus. And we would love to be able to do that, but it would probably require a staff of at least 5 times as many people as we have. So right now, it's not a viable option. When the student comes in and is evaluated by the initial evaluator, which is a trained psychological or social work, psychologist or social worker, we try to determine at that point if it's a short-term thing or a long-term thing. If it's a long-term thing, we refer that individual out to therapists in the community. When we refer that individual out to therapists in the community, we offer each one of those people to get hooked up with a referral coordinator, of which we have about, at this point, 8 on our staff who are doing that part-time. The referral coordinators are trained in understanding insurance and transportation issues and what therapists do, what specialties. We have a referral database of probably 300 therapists in the area, broken down by cost, insurance, location, specialty, all those types of things. And so we try to make an initial referring out with that. The referral coordinator can help with that process, because a lot of times younger students are not aware of how the insurance process works, or perhaps a student who's in a lot of distress doesn't necessarily feel like they're able to take that next step of calling and leaving a message for a therapist and waiting for a call back. So those are all things that the referral coordinators help with. We do refer out between 25 and 30% of the students that we see at evaluation into the community.
Gotcha. Well, it's good to know that there's someone there to help with that process as well.
And it's also something that we are continuing to try to improve. We've got a student-led task force right now that's working to establish a relationship with Lyft to possibly provide transportation for students so that they don't have to try to figure out how to get to their car and then get to their therapist and then get back to the parking lot and those types of things, that they could just get a Lyft and move right straight to therapy and then come right back. So that hasn't been established yet, but we're in the initial discussions around that.
Yeah.
So it's a continuing process of trying to improve it to make it as user-friendly for the student as possible.
Absolutely.
And really, to piggyback on Alan's comments, for medical services, there certainly are services that our providers that go beyond the scope of what Campus Health provides, and that our providers are making referrals to specialists for diagnostic tests that may be indicated. And so we have also a referral coordinator that works with our students to actually make the appointments for them around their academic schedules and sometimes social schedules, and to make sure that they can get to those appointments, and also make sure that whoever we are referring to is an in-network provider with the student's insurance.
Gotcha. Well, that's all very good to know. So if a student needs care, what are the hours of operation for CAPS and Campus Health, as well as where you all are located?
Okay. We're located between the hospital emergency department and gate 6 of Keenan, the football stadium. We are accessible from Manning Drive, and you would take the signs that lead you to the emergency department. We have 26 dedicated parking spaces that students who are driving to access care can access. We also are accessible through point-to-point. We're open from, during the academic year, we're open from 8 a.m. until 6 p.m. On the Campus Health side, 5 p.m. On the CAP side. We're open during the academic year also on Saturday and Sunday from 8 a.m. to 5 p.m. for non-appointment based urgent care type services as well. When we're not open, we have a medical provider that's on call 24 hours a day, 7 days a week. We're the only university within the UNC system that has 24/7 on-call medical and psychological support, and students access us by calling the main campus health number. They then are able, through a menu option, to connect with HealthLink, which is a 24-hour a day, 7-day a week nurse advice line that is able to identify what the student's concerns are, determine based on clinical criteria whether the student needs to access the emergency department, whether they need to go to an urgent care center, or whether they can wait until the next day or the next time that campus health is open. If they determine that a student needs to be put in touch with a medical provider, they take the student's number, contact the medical provider, and that medical provider is back in touch with the student. And then CAPS is very similar in terms of the 24-hour, 7-day a week access.
Yes.
There's
Also
a mental health provider on call as well.
So if a student wants to make an appointment, whether they're sick or I guess if it's considered like a well appointment as well, how would they go about doing that? I'll let Alan talk about CAPS in just a second. On the campus health side, we have 3 ways that students can make an appointment. Monday through Friday from 8 to 5, they can call our main number and they can speak to an appointment representative. They can also go to our website, campushealth.unc.edu, click the appointments button, and they're able to make an appointment online. And they can also go to their web portal and request an appointment, and a member of our appointment staff is back in touch with them. And we try our best to make sure that there is continuity in terms of students seeing a provider that maybe they've seen before for a similar condition, but we're really committed to making sure that we have appointment availability so that, again, it is complements the student's academic schedule and is being able to help them, at least from an academic success standpoint.
And regarding counseling, one of the real confounding problems with campus mental health centers across the nation is that as services have continued, or the need for services has continued to rise, that if we offer appointments, the appointments fill early in the semester, and then a student might have to wait 2 or 3 weeks then to be seen for an initial presenting concern, which is why about 12 years ago we went to the walk-in service model. So as a result of having a walk-in service model, we don't do appointments for initial contacts, but we do guarantee that a student can be seen on the same day. Then once that student sees the therapist, then if that student is going to be seen again at Counseling and Psychological Services, that appointment is then made by the therapist, and the student then continues to make appointments through the therapist. But for an initial contact, it's just walk-in.
And I should mention also that while we encourage appointments in campus health, students are always able to, or those who have paid the health fee are always able to walk in for services. And all of our services on Saturday and Sunday are on a walk-in basis.
Gotcha. Yeah. So let's focus on CAPS for a little bit.
Sure.
So appointments are walk-in. Can you talk a little bit more about, like you said, the limit, if there is one, on being seen?
Yeah, the limit is a great urban legend that is going around campus. I've heard 4 sessions, 5 sessions, 8 sessions. Those are about the main, no sessions. I think another myth is that you have to be in substantial distress to come to CAPS. So it's difficult to talk about a limit. We have had limits in the past. We always end up breaking those limits. And those limits are always a source of frustration for individuals. About, I want to say 8 years ago now, we were petitioned by a student organization to not have any limits. And so we moved to ostensibly not have any limits, although we had to have some form of limit. And that limit was the difference between brief therapy and longer term therapy. As you might imagine, that varies from individual to individual. It's not that we can say in 5 sessions, everybody has completed brief therapy. Some people begin brief therapy and find that it goes much deeper and then have to go to long-term therapy. So I wish I could say that there was a number, and I wish I could say that there wasn't a number. We try as therapists gauge it on an individual basis. We do know from the data that most students average out at about 4 sessions of psychotherapy. So I think that may be where the mythical number comes from, because I'm not sure we ever limited it to 4. There have been requests for models where students would pay 4 sessions after a particular number of sessions. Our concern in doing that is that we don't want to have any barrier to service for students who might not be able to afford that, which is why we've kept it as open as we have. But it's an ongoing process of trying to figure out how to best serve the students with the increasing mental health needs.
Absolutely. And you touched on this talking about kind of the different roles within the staff of Campus Health. But how does a student go about requesting medication services through CAPS?
So they would come in for an initial walk-in visit and be seen by a therapist. That would even be the case if a student had been on medication for a number of years and had just come to the university. They would still need to come and see a therapist and let the therapist know that. The reason to see a therapist is to make sure that there are not any other issues beside the medication issue that also need to be dealt with. Those can be issues of psychotherapy. They can be issues of intervening academically, or a host of connecting students, a host of things that we could connect students with at the university to be able to help them manage their stress. But a student comes in and requests to be seen for medication, and they get established with a medication provider. We've been lucky to have our resources for medication providers go up recently. So for the first time in probably 10 years at spring break, we're still less than a week away from being able to have someone see a medication provider. It's generally 3 or 4 weeks by this time. So we've been very lucky in that capacity. We hope to be able to continue those resources.
I gotcha. So as far as treatment-wise, could you touch on what group therapy is and if that is as effective as, say, individual therapy?
Yeah, it's a great question. Yes, the answer is yes, it is. And it is something that a lot of counseling centers are moving more towards because it's easier and equally as effective frequently to see a number of students at one time if they all share a common issue. We have about 20 groups per semester, 20 different types of groups per semester at counseling, ranging anywhere from dealing with the effects of sexual assault to dealing with shame to dealing with assertiveness, gender issues, a variety of things. And they're really well-attended groups. Our groups fill up relatively quickly, but it's equally as effective treatment. And a lot of times for students who are struggling with how they interact with others, it can be actually a better form of treatment for those students because they're in a position where with a therapist, they're actually having to interact with their peers.
I gotcha. Yeah, so I want to remind all of you that are watching to submit your questions in the comment section here on our Facebook page if you have any questions for these two, and we'll be sure to get those answered. But let's talk about the Campus Health student fee.
Okay.
So what does that look like? What does it go towards?
Sure. There is a health fee that is required, mandatory, whether you access services or not, that every student pays as part of his or her tuition and fees. At Carolina, it's currently $400 a year that's billed on a $200 per semester basis. And that fee provides Carolina students with services for which we are not going to bill insurance. And so unlimited visits for primary care, CAPS visits, access to the urgent care services that I mentioned, nutrition services in some fashion, first visit medication management services. It also allows us to provide those services for which we are serving the community at large. An example would be academic intervention services when students need to withdraw, have underload for medical and psychological reasons. Also allows us to be the public health department on campus whenever we have certain communicable diseases that we need to be involved with. Provides just a host of services for which we are caring for the entire campus community. Then The next step of that often creates some confusion is that all students, as a condition of their enrollment in a UNC system school, must have health insurance. And they either have to purchase the student health insurance plan, or they have to provide evidence through a process we call waiving out of indicating that they're on their parents' plan or have other health insurance for which they do not have to purchase the student health insurance plan. And then from an insurance standpoint, we bill insurance as an in-network provider for services like lab, radiology, prescriptions, in-office procedures, those kinds of things that aren't covered under the campus health fee.
Gotcha. So for people who may not know, what is the student insurance plan and what is that?
Sure. The student health insurance plan is a system-wide plan that covers all 16 campuses. It is available to students if they either need a elevated plan or if they do not have access to health insurance through their parents or otherwise. It is with Blue Cross Blue Shield or Student Blue at the current time. We go through an every 3 to 5 year renewal process to make sure that we want that to continue. It's a gold rated plan. So if it was on the Affordable Care Act marketplace, it would be a gold rated plan. It's an 80-20 plan. It has a $500 deductible. So it's a very good, broad, full coverage health insurance plan. The premium at this point is about $2,500 a year. It's billed on a semester basis through the student's account. If they elect to purchase the insurance, if they elect not to purchase the insurance, the premium will always show up every semester on the student's account. And after the student, or in some cases the parent, provides evidence that they have another kind of insurance, then they've waived out and that premium is removed from their student account.
I gotcha. So after a student seeks care with either CAPS or campus health, what are guidelines for patient confidentiality?
First of all, our university, from a privacy and confidentiality standpoint, is considered comes under FERPA, a federal law that is related to educational records. Our university council has actually determined that our students' health records are covered under FERPA, and so our students sign a visit-by-visit consent form, and that consent form allows us on a visit-by-visit basis to either keep that information private, or they give us permission essentially to share with anyone that they designated to have access to information about that visit. We do not accept blanket authorizations. In other words, one signature that allows someone to have access to that student's records for any way that they access campus health. Alan can talk a little bit about CAPS in just a second. The thing that I would make sure that everyone knows is that this does not mean that we are not going to contact a parent or an emergency contact in an emergency situation. Certainly, if the student is incapacitated, then we are going to reach out to that emergency contact. It's very important, if a parent wants to be the emergency contact, that the student has put them as the emergency contact in the Connect Carolina system. I always, kind of with a smile on my face, will tell you that we have some students that think about, okay, an emergency situation. Who do I want called in an emergency situation? Oh, I want my friend at UNC Wilmington, because their idea of what that emergency might be different than a medical emergency. So it's important that the emergency contact on the student's record be the parent, if that's who the student wants contacted in a medical emergency. There's a little bit different privacy concern as it relates to, or privacy issue as it relates to counseling that Alan can discuss.
So when a student comes in for counseling services, anything that they say is confidential. And the only exception to that would be if the student was in imminent danger, in which case we would need to break confidentiality. If they were in imminent danger and we needed to break confidentiality in order to save their lives, or if the student signs a specific consent designating exactly what they want shared with, who they want it shared with. So the confidentiality is very strict at counseling.
And the one caveat I did want to mention on the medical side is we do have some students that are under the age of 18 that come to Carolina, or when they come to Carolina, they're 17 and not yet 18. In those instances, we are required to, for anyone that's under 18 on the medical side, to contact the parent prior to the initiation of any medical treatment.
Gotcha. And one thing that you mentioned, and one thing that I think is worth stressing is, say someone wants to edit or update their emergency contact, that is through Connect Carolina, not necessarily specifically Campus Health.
Exactly. They go into their Connect Carolina system, they update that emergency information, and that flows to Campus Health through a record interface.
Gotcha. Okay. Just wanted to make sure that we knew that it was university-based.
That's perfect. So it's really, for parents, it's certainly worth on occasion just making sure that that information is correct in the Connect Carolina system.
Absolutely. So that kind of covers communication with parents and family members. But how does CAPS and Campus Health communicate with students as far as updates with either lab results or anything like that?
Sure. All of our students have a portal through what we call Healthy Heals portal, healthyheals.unc.edu. Students use their onion and password. It allows them then to have secure, confidential, HIPAA and FERPA protected communications with their providers, allows them to see lab results, allows them to go in and request appointments. And so that's really our mechanism for communicating clinical information with our students. We certainly have a website. I don't know, we have the numbers of hits to our website are staggering. They're over 1 million a year, but I don't know that students are routinely using our website for information. They typically are using Twitter and Instagram and Facebook and social media, and we use lots of social media in order to communicate important messages to our students.
Same for counseling.
Yeah, so what is the name of your website if someone wanted to access it?
It's at campushealth.unc.edu. And then that website actually can connect them with all of the other social media sites.
Okay, perfect. And
for us, it's caps.unc.edu.
Okay, perfect. Just wanted to make sure everybody knows how to access that.
Of course. And you can actually, by accessing one, you can get to the other.
Okay.
Because they're linked.
Good. So we've touched on this a little bit, but are there any frequently asked questions that both of you experience in your roles with Campus Health and CAPS? Anything that maybe hasn't been covered?
I think that our there's a significant amount of questions related to accessing campus health versus accessing other healthcare resources in the community, and what's the best approach. We always encourage students to develop a relationship with a primary care provider. If you're a student at Carolina and you live in Rocky Mount and you have a physician that you've seen there during your entire life, that may absolutely be the provider that you're going to use on an ongoing basis. But when you're in Chapel Hill and you wake up in the morning and you're not feeling well, and Rocky Mount's and you've got classes, it's important, we think, that you have a relationship with a provider that's here that can direct you in the appropriate fashion to medical resources here. I think also that that the confidentiality issues are ones that we hear about. Immunization requirements we hear about. We get questions. We have a full service accredited travel clinic for students that are going to study abroad. And so we encourage students to access that. It's destination specific, and they're able to determine what immunizations and what prescriptions they need based upon where they're going to be studying.
I think probably the thing that I would like to communicate that we haven't communicated yet is students will frequently ask, if I tell you anything, is this going to affect my career path? And I think a lot for professional students. What will this mean? How will this information get out there? And I would say that has changed substantially in the last 20 years, the answer to that, especially in the professional schools. Most of the professional schools, if the school is going to ask anything about a person's mental health status, they're generally going to ask, have you been impaired by a mental health issue or substance abuse issue? To which the student can then make an answer. I think if a person has had to be hospitalized, then it would count that they had been impaired to some degree. But the rest of the time, I think they can make the decision about that. And when I'm asked to give any information, I basically can't give any information to anyone at all without written permission.
Perfect. Well, is there anything else that either of you would like to add about things you think family members should know?
Well, I think that the last thing maybe that I would add is that my professional background, I've been at Carolina for 8 years now, but prior to that, I was in the hospital and private practice, so really in the private sector in healthcare. And I've drank the Kool-Aid, so to speak, in terms of understanding the value that Campus Health and CAPS provide to students while they're at Carolina. We have a very fragmented healthcare system right now, but on our campus, I believe that our students are going to receive the most coordinated care that they may receive in their lifetime, given our current system. Our providers are talking with each other. We're integrated from a medical and a mental health standpoint to really take care of the students while they're at Carolina and to make sure that their physical health, mental health, and well-being allows them to be the very best they can be while they're at least at this part of their Tar Heel journey.
Absolutely. Well, I'd like to thank you both for your time here today.
Thank you.